Well, now that cold weather is here, you might feel a few more aches and pains. But is the cold weather to blame? And how do we know if it's something that's more serious? MU Healthcare orthopedic surgeon James Keeney joins us to talk more about joint pain. Dr. Keeney, good afternoon.
Good afternoon, Elizabeth. How are you?
I am good. Thank you so much for joining us. Now, I'm sure you hear complaints that the cold makes those aches and pains worse. Is that really the case?
Well, I think if for people who have arthritis, they can notice that their symptoms get worse when there is a combination of cold or humidity. So for the wet weather will come in the springtime, but certainly in the wintertime, the joint pain may increase.
Now, if you have serious pain in your knees, hips, or shoulders, how do you know when you should see a specialist or when not to?
Sure. I mean, the first thing we have patients do when they're having a concern is to start with a rehabilitation program and possibly meet with their physician or meet with a therapist and start on that course of treatment. That's as long as people are able to walk effectively for their knees or their hips. If people are having trouble walking, that may benefit coming and seeing a specialist and getting an evaluation and treatment from that point.
Wonderful. Now, what would you say are some common treatments for those people who have bad knees, hips, or even shoulders?
Yeah, the starting point is usually using an anti-inflammatory medication or an analgesic medication, Tylenol-based product, to see if that will manage symptoms alone. If that does well, then that's perfect. And if it's not quite enough, the next step may be a sequence of medications or injections that we can deliver it directly into the joint with a much more strong medication. And that's usually the next step that we would do.
Now, for those who have severe pain and mobility issues, who is a candidate for this joint replacement surgery?
So joint replacement surgery is a wonderful treatment for patients who have been crippled from their disease over the span of many months. And usually after we've tried these other kinds of treatments first. Joint replacements, we make that decision by using x-rays and sometimes more advanced studies like an MRI or a CT scan. But we use those studies to tell us who has really advanced or severe arthritis. And for those patients, joint replacement provides a very reliable and durable approach to pain relief after the surgery.
Dr. Keeney, how has this all evolved?
Well, that's a long story. 50 years ago or so, John Charling developed the hip replacement, and so that was the start of this. And about 10 years later, knee replacement surgeries were developed, and a surgeon in the United States named John Insull pioneered this largely in New York City, and then it grew from there. The surgeries have become refined over the course of the last 40 years. Now, most of the hips that we do are done with cementless implants that are made out of titanium with a plastic liner and a ceramic ball. Most of the knee replacements we do are fixed with cement, although there are some cementless, not glued on implant technologies today, but they've been refined in ways that make the mechanics of the joints work much better than they did with the initial versions from 40 or 50 years ago.
And tell us about the recovery time. Is it fairly quick?
Yeah, so the recovery process has moved along because of the way we approach care. So we try to get patients working with a rehabilitation program ahead of their surgery and continuing that all the way through the process. And then we work on getting patients up very quickly after their operation with a short-acting spinal anesthetic or a general anesthetic, as well as pain medications that are delivered directly into the joint at the time of the surgery. And so we find that that's really helped the mobility of our patients to be able to leave the hospital within a day or so, and sometimes even the same day of the operation.
All right, Dr. James Keeney, thank you so much for joining us. Some very good information. Coming up, Elise will have our Christmas forecast.